Guys, I'm Sebastian. I'm going to cover an exercise, a really great one today we like to use for deep glute ache and sacral pain. Let me show you the areas of my body that I'm talking about. The sacral pain is just right around kind of this low area. Some people note it even goes down into the tailbone and out into the glute area right here. It feels like it's so deep like you want to pound on it. A lot of times people in this scenario really don't have back pain. They really don't have they have stiffness, especially when rounding, but it's really not pain. There might be tenderness, and this is the kind of scenario that I'm talking about, and I'll show you on Bob Norman in a little bit why maybe these things are occurring, but let's just go with the exercise at this point. Okay, so as we do this one exercise, by the way, it's called a diagonal sit. The diagonal sit is one that we like to coach in a few different ways here at Performance Place, and I should note that exercises sometimes go really well, sometimes they don't. By the way, if you ever want help, we can help you virtually or in person. Links in the description below. Exercises should provide a therapeutic value. As you know, doing some activities make you feel worse. Some make you feel better. And it's nearly immediate. Exercise and corrective exercise can do the same thing. And so what I encourage you to try, if you haven't already before, is move around. See how you feel. Does it feel stiff? Does it feel like the ache is there? Does it hurt more when you walk? A lot of times people feel this when they walk. And so maybe running. And so maybe next try this exercise and see if it actually holds therapeutic value. It might not, okay? There's a lot of exercises that we would show you that won't help because it's not specific to your problem. But also it's the way things are coached too, okay? All exercises, if useful, can provide nearly immediate therapeutic value most of the time. So in this one called the diagonal sit, using this situation, I want to coach the person into a little bit more of I don't want to say rounded position, but I don't want their spine to be too attentive. I can already feel in this position right now as I'm flaring my ribs out just as so, I feel this sensitive spot in my back and I feel my glute to start aching, okay? And so in this one, we're going to slightly modify this and I'm going to encourage myself to have a little bit of a round by starting in this position. We call this the take a picture at the beach position. I'm taking a picture at the beach. I'm looking at you, kid. Okay, so I'm right here. Now all I want to do is actually attempt to push my knee through the ground, and I'm actually going to use this band as a nice external cue. If someone were over there pulling on it, it'd even be better because they'd try to steal it and I'd try to pin it down. I'm not going to focus on anything else other than just purely pushing that band down. I don't like people looking at it, but if they need to have the attention, they can actually look at it if they want to. And by doing that, I feel this left butt cheek just start to smoke, okay? Like I can smell what we're cooking in here. It smells like hamburger, okay? And so if there's hip pain, I'm going to change it slightly. If there's back pain, I'm going to change it slightly by creating a lower angle. And I'm going to go here and push super hard through that spot. I'm barely coming off the ground, as you can see down here. Okay, push, 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 and return. I don't want you to think about anything else but trying to push that thing about 10 feet into the floor. Let's go again. Push, 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 push. Notice if I push super hard, my foot actually starts to raise like yours will. And return. Usually we have people do that for about 70-80% perceived effort until their left glute feels like it's really on. We might do the other side, and then we have them go check things out. As I mentioned earlier, no exercise should create the problem you're trying to reduce. If it did, we'd slightly change it, or we'd scrap the exercise, or we would regress you to a different activity which settles your pain down before we return to this one. Don't blow through pain, all right? If you feel like you're doing that in your rehab exercise, you might need to have someone actually coach you directly to make sure that things are actually going well for you, okay? So I'd love to help you guys out if you want us to help you out. I'm Sebastian at Performance Place in Costa Mesa, California. We're locally world famous. Let me show you real quick on Bob Norman here what we're talking about. So as I mentioned here, there was sensitivity right around here on my spine. Sometimes there is referral from this area being a bend point, and it refers down into here and into here. It's actually pretty common. I know that some of you might be like, no, I heard it says glute muscle, and I heard it's that. I know, I hear you. We do have people that actually have those problems too, but surprisingly, it's if you think about it, you can have a local muscle issue, or you can have something that refers to it, right? Because something feeds the muscles electrical energy that comes from the spine. It has there's input, right? And so it can come from there, and it can tell it to become tight. And as soon as you reduce the spinal thread, a lot of times this goes away. And exercise is a really good way to do it if done well. So if you guys want help from us, we're here to help. Our link is in the description below. We have lots of videos just like this coming out. Subscribe to the channel. We'll see you guys next time.